Good morning. First, I'll take this opportunity to thank Dr. Kitsri and his team for inviting me to deliver a lecture today. Actually, although I'm going to talk about the fatalities and injuries, you must know sport and exercise has many benefits on all our body systems. To take the cardiovascular system, respiratory system, endocrine system, neurological system, many benefits are there. It helps to prevent cardiorespiratory diseases, malignancies, it helps to prevent dementia, and so many benefits are there. But as Dr. Amal Harsha mentioned, if you do things in the incorrect way, like any other medication, there are adverse effects. So you must know how to get the benefits by minimizing injuries and fatalities. When I say fatalities, now not only injuries, there are other causes which can endanger your life. So my lecture will cover, may overlap with other speakers, but any reinforcing certain knowledge over and over is no harm. So now generally, when you talk about, before I talk about injuries, there are certain other causes which can cause sudden death during sports. Now, so many causes are there. The commonest causes are related to our cardiovascular system. Now certain research studies have shown in middle-aged and elderly athletes, the commonest causes being atherosclerotic coronary artery disease. ඒ කියන්නේ හෘදය වස්තුවේ ධමනි වල සම්බන්ධයක් නිසා තමයි මේ මරණ ඇති වෙලා තියෙන්නේ. And some of the sports that were involved were golf. Golf is not a very strenuous sport, but even people playing golf has collapsed due to these causes. Then if you take then there are young people, maybe about in their 20s and 30s. They too have died during sports. Maybe cyclists, like that was because of some cause called arrhythmogenic cardiomyopathies, and there are things called hypertrophic cardiomyopathies. Arrhythmogenic cardiomyopathy means හෘදය වස්තුවේ rhythm වැඩ කරන rhythm එකේ ප්‍රශ්නයක් නිසා තමයි ඒක වෙන්නේ. Then cardiomyopathies are like sometimes හෘදය වස්තුවේ සමහර chambers අනිත් ඒවාට වඩා ගොඩක් ලොකු වෙලා තියෙනවා. ඒ වගේ නිසා මැරෙන්න පුළුවන්. So there are so many. Then myocarditis is another problem. Myocarditis can හෘදය වස්තුවේ මාංශ පේශි වල ඉදිමීමක් වගේ හේතුවක්. Myocarditis. Then, in addition, so many causes are there related to the cardiovascular system. Then, and the next thing, there are other injuries related to now, even asthma. If it's not properly managed, it also can cause death. Then brain injuries, as Dr. Chaminda mentioned, brain injuries are there that also has lead to death. Then cervical spine injuries. Then uncontrolled diabetes. They too have caused problems. Then exertional during heat stroke. Now, during high temperature with high humidity, you are more prone to get heat-related injuries, especially our soldiers, athletes playing in very long-distance road runners during very warm and humid times. You have seen our people running during very warm and humid times, right? Then electrolyte imbalances, hyponatremia, those sort of things also can cause problems. Then even lightning has been another cause for death, right? These are some of the causes of death that has been that has caused deaths. Then if you take injuries, you can divide the injuries into acute injuries and repetitive injuries. Acute injuries could be due to two players coming and contacting with each other, then or due to falling from height. Now here what you are seeing is a posterior cruciate ligament tear. This can happen during hyperflexion of at the knee joint, right? Then Achilles tendon injuries are again, this can be due to deceleration forces. Then concussion. Then what you are seeing on the with related to the eye is a globe rupture. Sometimes during play, sometimes a person's finger goes into another person's eye. or sometimes maybe like a golf ball hitting your eye, you can get a globe rupture. Then in a globe rupture, the person will not be able to see. Then sometimes like maybe like a leather ball, it can hit the orbital rim. Then you get an orbital rim fracture. Then you can have your vision impairment is there. At the same time, you can have double vision during movement of the eyeball. Right. So those are some of the acute injuries. Right? Then if you go to, I won't talk much about injuries because a previous speaker spoke about injuries. Then there are things called repetitive injury. Now in racket sports where you repeatedly do so many repetitions, you can end up getting repetitive injury. One is they call a tennis elbow or a lateral epicondylitis. Then you can also get the medial epicondylitis. They also call it the golfer's elbow. Not only golf players, even others can get this. Even housewives can get this, right? Depending on the work you do. Then other thing, repetitive, sometimes there are things called shoulder impingement problems. Swimmers can come with this type of problem. One is because there are biomechanical reasons there. When you are continuously doing certain movements, your certain muscles, like maybe the internal rotators, become much stronger than the external rotators. The other thing is scapular protractors become much stronger than the scapular retractors. So there are biomechanical reasons for this type of injury. Then fast fractures. Now, certain fast bowlers during repeated bowling action, sometimes due to the certain techniques of bowling also can give rise to fast fractures of the spine. So these are some of the type of injuries you can experience, right? Then other thing, if when a person sustains other thing, when you are exercising or taking a sport, you must know dangerous signs and symptoms, which will tell you that you need to watch. One is history of passing out during or immediately after exercise. Then next is chest pain with exercise. Sometimes if you are getting unusual fatigue ability, then if you are having misbeats, then if there are abnormal heart sound, if you are getting dizziness, confusions, headaches, those are warning signs which you will need medical attention. Right? So these are some of the warning symptoms and signs. Next thing, then if you take signs of sports injury, sometimes the common things they might present with pain, swelling, redness. Sometimes you may have to be carried off from the play. Inability, that means inability to bear weight. Then there can be joint instability, especially in cruciate ligament injuries. You might feel the knee moving front way, back, front and back directions, or maybe then collaterals which may cause sideways movements. Then your joint range of movements can be impaired. Then also, if there are meniscal problems, you may complain of locking sensations in the joint. And sometimes even patients say they heard a sound, after that they could not walk and they had to be carried back. So like sometimes cruciate ligament injuries, before it's damaged, they say they heard a pop-like sound, right? The other thing, in addition to this, there may be associated neurovascular injuries. They may complain of pricking sensations, burning sensations like that, right? So these are signs of sports injury which you have to watch and provide the necessary first aid and treatment. Then you must also know what are the contraindications to take part in sports. There is something called carditis. Carditis means hridayavaspaya mangsha wala idinimak wage tiyenawna, then it's not good to take part in sports till it's corrected. Then when you are suffering from fever, if you are suffering from diarrhea, vomiting, you are more prone for heat-related injury. And sometimes with fever, if you go to do exercise and take part in sports, you may get a myocarditis, depending on the cause, right? And so these are supposed to be contraindications to take part in sports. Then there are relative contraindications to take part in sports, like there are things like atlantoaxial instability, so many causes are there. Then sometimes you may have only one night. Then contact sports, it might be a problem. Then heat illness, diabetes, these are not absolute contraindications, relative contraindications. Then if you are having only one organ, enlarged liver or spleen, if you are suffering from convulsive disorders like epileptic problems, then these are relative contraindications. If you know the contraindications and relative contraindications, then you can take the decision before taking part in sport and exercise. Right? The next is now during a sport and exercise at a field site or maybe in a gymnasium, you must know what are the conditions that require an emergency transfer. If somebody is suffering from a respiratory arrest, maybe like a swimmer, then like while exercising in a gym, if somebody suddenly a middle-aged or elderly person collapses on the floor, you must always think of maybe he's having a cardiac arrest, myocardial infarction. You must call for help. And you must start attending on the patient. Then if there's an airway obstruction, then again you need, while giving first aid, to transfer into a hospital. Then if there's a suspected cervical spine injury, again, this needs emergency transfer. In addition to that, if you suspect a long bone fracture, pelvic fracture, multiple ligament injuries, they all need to be transferred to a hospital. Right? Then other conditions also, if you can't manage, like mild anaphylactic reactions, if it's severe, causing breathing difficulties, you must transfer after giving first aid. Then if you are suffering from severe bleeding, sometimes it could be internal or external. Now, long bone fracture, maybe femur, you can lose about 2 liters of blood. In a pelvic fracture, you may lose about 3 liters of blood. Then if you are suspecting injuries to liver, spleen, kidney, then if you have been loss of consciousness for more than 15 to 30 minutes, then open fractures, those sort of things need to be transferred to hospitals. Otherwise, you can't manage them at the field site. You have to give first aid and then you have to transfer. Then other conditions, there are like neurovascular injuries, multiple ligamental injuries. Then if you are suspecting acute compartment syndrome, in running athletes, sometimes they are more prone to get the pressure rising in the anterior compartment of the leg. So those sort of things you have to transfer. And if you are suffering from hyperthermia and hypothermia, like in a country like us, we are more likely to get hyperthermia. Like in a cold country, maybe hypothermia. Then if you are suffering from hypoglycemia, epileptic, those sort of things, eye injuries, dental injuries, you need to transfer. Right? Then there are many useful investigations depending on the injury and depending on the facilities available. You need to think what type of investigations you need to order. Right? Then what are the consequences of improper management? You can end with death. You can get hypovolemic shock. Sometimes a mild hematoma can become a massive hematoma. Then concussion can end up with memory problems, personality changes. Then mild anaphylaxis can end with severe anaphylaxis. Then partial muscle tears can become complete tears. Stress fractures can become complete fractures. So proper management of injuries is essential. Then there's something called, to prevent these things, you need to undergo something called pre-participation screening before taking part in sport or exercise. If you have not taken part in exercise for a long time, better to undergo a medical exam. In this aim of the medical examination, one is to assess overall health. Other one is to detect conditions that may be injuries that can get aggravated. Other one is there may be conditions that may disqualify you from a particular type of sport, like you are having maybe a one organ, may get disqualified. Other one is you have to see whether there is something called assess for fitness for sports, like whether you are fit for that sports. There is something called athlete profiling, which you can make use. Then by assessing, you can make recommendations for their exercise and rehabilitation programs. Then also you can counsel them on various health related matters. Maybe if you're diabetic or hypertensive, you can give necessary advice. Then other one is there are legal and insurance requirements. Now, pre-participation screening is a legal requirement. Even schools now, they send children for screening to hospital sports medicine unit. Then what to do following an injury? First thing, you must prevent further damage. Then also you must assess the vital functions, airway, breathing, circulation, and what are the disabilities. Then you have to give the necessary first aid. There's something called, early it was called the Price's regime, now it's called Police's regime. Here POLI means protect, optimum loading, ice, compression, and elevation. Early it was called Price's, R is for rest. Now it's called optimum loading. You don't need complete bed rest, but you put the pressure only up to the necessary amount. Right? Then there is something called decisions based on triage. Sometimes after an injury, you take the athlete and decide whether he needs immediate hospital transfer or whether he can be sent after the match, but keep him out of the sport. Other one is you have to think whether he can go back to sport. So then you have to make decisions based on triage. Next, before sending him back to play, you have to see whether he can play effectively and safely. For that, you have to check the range, whether how his pain level, whether his range of movement, whether his strength, whether he can do the sport-specific activities like whether he can run in a zigzag manner in a martial artist, whether he could do a roundhouse kick like that. You have to see whether he could do the sport-specific activity. Then if he's safe to play, only you have to send him back. Next, in addition to field side assessment, when you have time, there is privacy to examine a patient, you have to do a proper medical examination of all his body systems: cardiovascular, respiratory, musculoskeletal, neurological, abdominal, everything. Right? Then, what are the prevention tips? One is medical screening is important. Then they say one main cause for injuries is previous injuries that are not properly rehabilitated. So you have to do the full rehabilitation of previous injuries. Then, as Dr. Chaminda mentioned, there are many intrinsic factors and extrinsic factors. Intrinsic factors are your body-related things. Extrinsic factors are outside things like your body surface you are playing, the temperature, equipment, all those things are extrinsic factors. Dr. Chaminda has already mentioned, so I'm not going to talk about them. Then using proper protective equipment. Then you must also advise on proper fluid intake and nutritional intake. Then proper psychology. If you are not in proper psychology, you may take abnormal risk and again fall into problems. And sometimes if your psychology is not proper, when the rehabilitation is half done, you may want to go back. So these are some of the prevention tips you will have to follow. So if you follow these things, it may help in preventing fatalities and injuries, and you will be able to get the necessary benefits related to sport and exercise. So these are some of the references. That's all for today's lecture. So thank you.